So we went through in vitro fertilization in order to get pregnant, and so we had chosen to have only one egg, and we, at about 8 weeks, had an early ultrasound that showed us that we, in fact, did not have twins, because sometimes the eggs split, and we were very relieved to have that information. And then at 12 weeks for the initial screening ultrasound, we came in and they said, oh, there's a second baby here, which we were completely shocked by, and then very soon after told us that it was a completely abnormal looking baby. And for me, I'm also a physician, and I knew immediately that meant that even the baby that looked normal was probably abnormal too, because they'd come from the same egg and it had split. And they basically told us we had a 99% chance that this was not going to be necessarily a favorable outcome, that something would probably be wrong with the healthy-looking baby, and certainly something was wrong with the not healthy-looking baby. I mean, I would recommend it really to anyone, because I think that they've done the research to prove many of the strategies that they use. They've done the most of these surgeries for almost everything that they do here than any other place in the world, and that's mixed with that they're very compassionate and thoughtful, and their experience doesn't make them complacent and like, oh, we've done this a million times and this is so simple for you, the patient. I think each patient, they take the time to realize that it's so personal and hard to go through. Just absolute relief that he was okay. I mean, TRAP is maybe one of the better diagnoses to have, I think, just because many of the babies come out quite fine if they have the intervention. But I think you never know if they're going to be fine until you see that they're fine. And so seeing him come out and everything was moving the way it should, and he was doing all the things that he should, and he breastfed immediately and easily, and we actually had a very dramatic and difficult delivery, and so I think I had been heightened to be pretty nervous throughout the pregnancy, and then the delivery was pretty stressful, and it was just absolute relief to see him and feel him and just know that he was healthy. He's an absolutely wonderful baby. He gave us so much grief, through the pregnancy, and he's been, I would say a really easy baby. He's doing everything developmentally that he should. He has no leftover ramifications from having had the trap. And he smiles a lot and laughs a lot, and he's cooing and trying to push himself up to a crawl, but not quite yet.